Computed tomography. CT scanner basics and application. The journey from CAT scan to CT scan. 100 years ago, Wilhelm Conrad Röntgen, a German scientist, discovered X-rays. The discovery of X-rays. But anatomic structures were superimposed, and soft tissue couldn't be differentiated. Look inside the human body. This allowed people for the first time to be able to view the anatomy of the human body non-invasively. In 1972, two scientists, Hounsfield and Ambrose, presented the first clinical CT image. CT broke the barrier. But it was time-consuming, 10 minutes forward/image. And the resolution needed to be improved. So we could see tomographic anatomy and density differences. The human body slice by slice. What does a CT look like? Acquisition time 7 min, image matrix 80 x 80 pixels, scan field 25 cm, spatial resolution 13 mm, 4 lp /cm. Cyretum, in 1974. The first Siemens CT scanner. Cyretum, 1974. Smartum Plus 4 UFC, 1996. The progress in image quality. Gantry. Table. Generator. Console. Computer. From the outside. Console. Computer. Generator. How does a CT look like? From the inside. Tube. Detector. Das Asterisk. Tube. Detector. Das Asterisk data acquisition system. What? Recon and post-processing. Data acquisition. X-ray generation. How does CT work? X-rays pass through a collimator, therefore only penetrating an axial layer of the object, called a slice. Image generation, the slice. The slice is artificially divided into small volume elements called voxels with a square base, inside which the attenuation is measured as a constant value. And in plane, the picture elements are called pixels. Image generation, the voxel. The attenuation of radiation values is measured, encoded and transferred to a computer. Image generation, the matrix. The numerical matrix is converted into a black and white image in a corresponding grayscale. Asterisk analog, digital, analog. CT image generation, a /D. CT image quality. Spatial resolution. Contrast detectability. Artifacts. Criteria for CT image quality. The ability to resolve high contrast objects, also called high contrast resolution. This is influenced by system geometry and determines image definition. Spatial resolution. Definition. Scan time. Algorithm. Operating mode. Slice thickness. Image display. Image definition means the sharpness of an object relative to surrounding tissue. It depends on definition, when small contrast differences are crucial. Also called low contrast resolution. This is influenced by image definition and noise. Contrast detectability. Noise is superimposed on the image and results in a grainy impression, as is the case with poor TV reception. 200. Noise. Mass. The various structures or patterns that appear in a CT image, but are not found in the original object. Artifacts. Scan time. Operating mode. Slice thickness. They depend on patient. Artifacts. Noise. Mass. kV. Algorithm. Slice thickness. Patient size. Operating mode. Image display. Image noise is determined by the number of X-ray quanta that reach the detector and then contribute to the image. It depends on noise. The various structures, user, patient, system, influences on CT image quality. 100 Ms. 100 Ms. The complete system design determines how efficiently X-rays are finally converted to electrical signal as the detector output, after passing through the patient. The generator, tube, geometry, filtration, collimation and detector design all play a role. System efficiency. Mass. Asterisk noise reduced by factor 1.4 while dose is doubled. Tube current and scan time, determine dose. Low mass. High mass. Image 1. Low mass value. High noise level. Image 2. 4 times the mass value. Half the noise level. In the case of a soft tissue study, it is most important to keep noise to a minimum by using higher mass. The lower the noise level, the easier it is to recognize structures with minute differences in density. But for bone or lung studies, higher mass is not necessary. Recommendations for mass. The dose level depends very strongly on the voltage applied to the tube. kV relative dose. 140 100%. 120 58%. 80 12%. Tube voltage, kV. The higher the voltage, the more the radiation spectrum is shifted to a higher energy level, resulting in decreased radiation attenuation. This is most noticeable in bone and contrast media. 140 kV. 80 kV. Tube voltage, kV. Provide the recipe for mathematical image calculation. Algorithms. An edge-enhancing, high-res, algorithm produces good edge definition, but also a high noise level, while a smoothing algorithm produces a low noise level, but also poorer edge definition. For routine studies, a standard algorithm is normally recommended. Algorithms. High-res algorithm. Soft algorithms provide better contrast detectability with less noise. Algorithms. High-res algorithms provide better spatial resolution, but with more noise. Algorithms. A thick slice means. A thin slice means. Selecting a suitable slice thickness is a balance between edge definition and noise because of their mutually offsetting effects. Low noise. Better contrast resolution. Poorer edge definition. Partial volume artifacts. High noise. Poorer contrast resolution. Better edge definition. No partial volume artifacts. Selecting slice thickness. Slice thickness a half. Noise level 1.4. No of X-ray quanta 50%. Slice thickness. 3 mm slice. 10 mm slice. Thicker slices give less noise and better contrast detectability for soft tissue. Slice thickness. Thinner slices give better spatial resolution for bony structures. Slice thickness. Patient size. An attenuation by a factor of 2 results from each 4 cm increase in patient thickness, thus increasing the pixel noise. Patient size. This is the so-called CT number in Hounsfield unit, WHO. Rule of thumb. The CT value of water is 0 and air -1000. The relative values of the other tissues are calculated relative to that of water. Image display, windowing. The range of CT density values is defined from -1000 to +3000, but the human eye can distinguish only 30 to 40 gray scales at best. So, the window settings must be in accordance with the structures to be visualized. Lung window. Mediastinum window. Image display, windowing. Window width, W. The density range represented within the gray scale. Window center, C. The center of the density range. Image display, windowing. Narrow window width. Broad window width. Narrow window width. High contrast image, but structures outside that window range may be inadequately represented or overlooked. Broad window width. Minor density differences appear homogeneous and may be masked. Image display, windowing. This is used for the display of 2 tissue types differing greatly in their density values, such as the lung and the mediastinum. Double window technique. To see both lungs and mediastinum within image simultaneously. Asterisk double window is not recommended for diagnosis. Double window technique asterisk. Lung window. Mediastinum window. Double window. Image 2. Only lung. Visible. Image 1. Both lung, thorax wall and mediastinum. Visible. Image 3. Only thorax wall and mediastinum. Visible. Image display, windowing. Normally, CT values can be measured from -1024 to +3071, but with Smartum +4, this can be extended from -10,240 to +30,710 to visualize metals of high attenuation. Therefore, it is always possible to measure the real CT value no matter where and how the window is positioned. Post-operative femoral head replacement, the CT value is 6000 WHO. Extended CT scale. Reviewed. Magnified. Magnification. A purely optical magnification of image data which may result in blurred appearance. Review. A zoom reconstruction from raw data to enhance sharpness of details. Review versus magnification. The CT scanner system design determines how efficiently X-rays are finally converted to electrical signal as the detector output, after passing through the patient. Next part will see image artifacts and corrections. Thank you.
Dios. Dios.